So as soon as there's no swelling, we can start heating before we do our exercises to get the leg and the muscles warmed up before we perform the range of motion and exercises given. To begin your exercises, we're going to have you do called a heel prop. We're going to have you sit at a chair about the same height as another chair. Put your knee up, and this is trying to get full extension back into your knee. Just relax the leg. If you're having trouble extending, you can use a 2 to 5 pound weight at the knee to not stress the joint as much. And you're going to hold this for 5 minutes 3 times. The next exercise we're going to have you do are the next exercise we're going to have you do is quad sets. We're going to have you keep your foot up like this, and you're going to contract your quad on the injured leg, making a muscle trying to push down underneath my hand. There, you're going to do this, contract for 5 seconds, and then relax, and you're going to do this 15 times for 3 sets. For this next exercise, we're going to call it sitting assisted knee flexion and extension. So we're going to take your non-repaired leg, and you're going to hook that behind the heel of your repaired leg, and you are going to help that leg lift up and extend. Once you reach extension, you're going to hold for 5 seconds, and then slowly release it down, being sure to not let your knee bend past 90 degrees. And you're going to do this 3 sets of 15. To prevent any blood clots post-surgery and to keep the blood flowing, I'm going to have you do ankle pumps, about 10 every hour. And you're just going to bring your toes up to the sky and then point them down. You're just going to do this 10 times every hour. We're going to have you do some straight leg raises, so we're going to have you lay back. And then you're going to bend this knee up to about here. And what I'm going to have you do is point your toes up, and you're going to contract your quad as hard as you can, and you're going to lift it up, raise it up about 4 to 6 inches, about there. Hold it for 3 seconds, contracting the quad, slowly lowering it down, and then relaxing. You're going to complete this, you're going to do 3 sets of 10. And we're starting the week 2 exercises, continuing on with all the other exercises we did in week 1 as well. So the next thing we're going to have you do are some mini wall slides. So we're going to have you 12 inches from the wall with your feet 6 inches apart. And then you're going to lean back against the wall. And we're going to have you go down to a 45-degree angle, not letting your knees go over your second toe. Pause, hold for 5 seconds, and then come back up. And we're going to do 3 sets of 10. So the next exercise we're going to perform are some short arc quads or knee extensions with a bolster. So we're going to take something, either a rolled up towel, or you can use a ball that's about 4 to 5 inches high. Place it under the knee. We only want the knee to bend like 20 to 25 degrees. And then you're going to have them point their toes up, and you're going to try to extend, pushing down into the object, extending the knee fully. You're going to hold for 5 seconds, and then release down, and you're going to repeat this 20 times. So the next exercise is hip abduction. So we're going to have you lay on your non-operated leg with them both fully extended, and we're going to have you bend your foot, and you're going to bring your leg up to a 45-degree angle, hold for 1 second, and then lower back down. And you're going to repeat this 20 times. Our next exercise is standing toe raises. So we're going to have you face a wall. And what you're going to do is you're going to contract your quad, and then you're going to come up on your toes, hold for 1 second, and then lower back down slowly. And we're going to repeat this 20 times. So after doing the exercise and range of motion, we're going to do some IFC for some pain management with some ice. So when we do IFC, we cross the channels. So 1 and 1 are opposite of each other, and 2 and 2 are opposite of each other diagonally, with the pain localized in the middle of it. That's what we're trying to target. So we can add the ice. Woo! Keep it elevated. Wrap it on until the patient, until she feels it, and then going out. So we're doing Russian to help with her quad contractions and to activate the quadriceps after surgery. So we have 2 pads, one at the origin, one at the insertion of the quadriceps. And we have channel 1 set up. The cycle time is 10 to 50, frequency 50 beats. Ramp is 2 seconds, and the duty cycle is 50%. She's at about 19 intensity. It just depends on her feeling. So the quad's going to contract, and then it relaxes. Let's see if we can get it. There we go. Contraction. And she's going to contract with the machine when it does that to assist it, and then it relaxes.